You know, there may come a time where maybe from surgery or an accident, you might need some physical therapy. Well, there's a great place in Gaucher where you can do that. It's called Magnolia Occupational and Physical Therapy. Francis and Hannah are the owners here. How are y'all?
Good. How are you doing this morning?
I'm doing well this morning. Thank you very much. If you would, Francis, give us, Hannah's going to show us around here just a little bit, but if you would give us a little background how y'all got started with this.
So Hannah and I have worked the past several years in like a skilled nursing facility, and we were working with patients that usually transition from the hospital to our setting, and then they would go home and we'd find that they just need a little more therapy. And a lot of them would do home health, and then they might transition to outpatient afterwards, but we'd see them coming back to the hospital or other things were happening. And we realized that there's this really big need for therapy to kind of target that population and decrease recurrence of disability, caregiver education, patient education. And we just decided that we had this passion and we wanted to go out and do it together.
Mm-hmm. Now, people think about going through physical therapy or occupational therapy. They think, well, that's something you deal with mostly seniors. That's not true. I mean, you mentioned beforehand that most of yours are like under the age of 50.
Yes, yeah. So, we have this background working with the aging population and complex medical patients, but a lot of times we're really seeing people who are just, the people that have had shoulder surgery because they have a rotator cuff repair or repetitive injuries through work. So yeah, right now most of our clients are under 50.
Now, I'm sure you probably welcome, you mentioned, rotator cuffs, things like that. Sports accidents or,
Yes,
therapy
yes.
like, could be teenagers.
Yes.
Even.
Yes, we have had some teenagers before too. So that have had injuries due to sports and have, post-surgery, they've come to us, and, the surgeons around here are all amazing, and they're...
Oh yeah, I know.
So
I've talked to several of them in the area, and they really are great. What's the youngest patient you've had?
14.
14? Okay. But you do younger if necessary.
Well, we don't really do pediatrics.
Oh,
so
okay.
we do if it's like an orthopedic condition in that age-related type injury, then we'll see the younger population. But I will say 14 is the youngest we've had. I think it would just depend on their condition and what they needed.
Mm-hmm. Now, and again, as we get older, I hate to use that term older because I'm getting there, things just don't seem to work as easy anymore, and especially after surgery or an accident or something like that. So, I mean, Magnolia is a great place to come in here and go through a session, set up a series of sessions. And I guess they sit down and you talk to them and figure out exactly what they need to do? Yeah,
so each person that comes in through our door comes with a physician referral for sometimes it's OT and PT together. We really have a good interdisciplinary approach, whether it's PT or OT or both. Each person gets an individualized evaluation, and then that's when we create their plan and determine what their needs are. You were talking about the aging population, and people sometimes think they have to hurt to come to therapy. But a lot of times, as we age, we realize that we might have an illness like pneumonia or an infection that we're in the hospital for a couple of days, and we don't have to go stay at rehab, but we're not strong enough to go back to work.
Right.
So that's whenever, you just have that debility and you could really benefit from therapy. We'd have to assess, what your deficits are. If it's an endurance thing, usually it's multiple things because nobody has one thing wrong with them. I wish, right? It'd be great if we just came in the door and said, well, this is my shoulder and that's the only thing wrong with me. So it's a very complex, system, and we try to develop a good approach and personalized to each individual that comes through our door.
Okay, well, we're going to talk to Hannah now and find out some of the different exercises that they do provide here at Magnolia Occupational Physical Therapy on Highway 90 in Gaucher. Now, Hannah, talk about the differences between occupational therapy and physical therapy. I mean, this is the physical therapy side, right?
This is kind of both. This is more of my side of the gym, the physical therapy side of the gym. So I'm working on we kind of split the body in our clinic, where occupational therapy is going to treat the upper extremities such as the arm, the shoulder, the elbow, the wrist. I'm going to treat more of the lower extremity, which would be the leg, the hip down. We work together though to kind of treat the whole body. Occupational therapy works more with self-care, with fine motor tasks, being able to perform your everyday duties, whereas physical therapy works more on your big muscle groups, your things that help you get up, help you walk, those kind of things.
Your legs, your back, things
right.
along
So
that
this
line.
is all the tools that we use to address all those things on this side.
And I'm sure with each individual person, you know, like Francis said, you sit down and you plot out what type of, you know, program that they need to be on, and because everybody's going to be different.
Absolutely. Everybody is different. Some people need more strengthening exercises. Some people need more balance exercise. Some people need endurance, and that's where we might get on those bikes that we passed earlier.
Now, and as well, you've got, you have to take into account, okay, whereas my shoulder injury is going to be treated differently than someone a lot younger with a shoulder injury,
Right.
because you just still don't have that range of motion anymore.
It depends on your complaints and your personal goals as well.
Well, I don't want to be, you know, don't think I'll be pitching in the World Series anytime soon, but, you know, some of those guys. Now, over here you have more areas for people to work out.
Right, so this is another kind of corner of our clinic, and this is where we do return to work and functional capacity evaluations for like workers' comp and disability claims. So this is where we take
So the
someone-
ladder and everything on the wall here is part of the therapy.
Right.
I just thought y'all were, you know, we're working over here doing something.
No, this is part of the therapy and the assessments that we do. So we assess if someone is able to climb a ladder, to pick up weights, to do overhead activities for a long period. Depending on what their job requires, we can assess and determine if they're able to do it or unable to do it.
Okay. Now, I notice you got a lot of yoga mats over here.
Yes, so this is another part of our clinic. We love to encourage our clients to continue after their discharge from therapy to continue with some kind of activity. So we have a wellness program where we offer yoga classes currently, and they can participate while they're a current client or after their discharge, and it's also open to the public.
Oh, nice. I mean, and yoga, that's been around for centuries. I mean, and it's a great way to exercise and, you know, all parts of the body.
Absolutely. Our yoga teacher focuses on strengthening, on stretching, also on breathing.
Okay, now, if someone wants to use your services, what do they need to do? I guess you take insurance and everything.
We do. We accept most insurances, specifically Medicare. They have to obtain a referral from their physician, and then we call them to schedule the appointment.
Okay. Well, again, if you are, you know, or a loved one in your family needs, you know, some physical therapy or something like that, occupational therapy, what you need to do is give them a call here at Magnolia Occupational and Physical Therapy. They're located on Highway 90 in Goshen.
Yes.
Yeah, just a matter of fact, it's right across the street from Mississippi Gulf Coast Community College, Jackson County campus.
Yes.
All right. It's a pleasure. Thank you so
you.
much.